Question 1. A 25-year-old man travels to Mexico for vacation. 2 days later, he develops profuse watery diarrhea without blood or mucus. He has mild abdominal cramping, no fever, and no vomiting. Stool cultures are negative for inflammatory cells. Which of the following is the most likely cause of his symptoms? A. Shigella. B. Enterotoxigenic Escherichia coli, ETEC. C. Entamoeba histolytica. D. Vibrio cholera. E. Enterohemorrhagic Escherichia coli. B. Enterotoxigenic Escherichia coli explanation. ETEC is the leading cause of travelers' diarrhea, especially in people visiting developing countries. It produces heat-label LT and heat-stable ST toxins, stimulates CAMP and CGMP pathways, C elements, and water secretion, watery diarrhea. There is no inflammation or invasion, so no blood or fecal leukocytes. Why not the others? A. Shigella sane causes bloody diarrhea with fever, often with fecal leukocytes due to mucosal invasion. C. Entamoeba histolytica causes bloody diarrhea, dysentery with fever and tenesmus, seen on stool microscopy with trophozoites. D. Vibrio cholera also causes profuse watery diarrhea, but usually in outbreaks and associated with contaminated water, rice water stools, less common in individual travelers. E. EHEC causes bloody diarrhea, produces Shiga-like toxin. No fever or invasion, but associated with hemolytic uremic syndrome, U.S. Question 2. Which of the following best describes the mechanism of the heat-label toxin produced by Enterotoxigenic E. coli? A. Activates guanylate cyclase, CGMP-B. Inactivates 60S ribosomal subunit C. ADP ribosylates GS protein, CAMP. D. Blocks acetylcholine release at neuromuscular junction. E. Stimulates macrophage IL-1 production. Phi ADP ribosylates GS protein, CAMP. Explanation: the heat-label toxin, LT, of ETEC acts like cholera toxin. ADP ribosylates the GS protein on enterocytes, persistent activation of adenylate cyclase, CAMP, secretion of C-L-thanins and H2O into the intestinal lumen, watery diarrhea. Why not the others? A. Activates guanylate cyclase, CGMP. This is the mechanism of heat-stable toxin, ST of ETEC, not heat labile. B. Inactivates 60S ribosomal subunit, mechanism of Shiga toxin, Shigella, and Shiga-like toxin, ESHEC. D. Blocks acetylcholine release, mechanism of botulinum toxin causing flaccid paralysis. E. Stimulates macrophage IL-1, seen with bacterial components like LPS, endotoxin, not specific to ETEC toxins.